finding a spot to do some volunteer work has been one of the most positive things that I have done since being diagnosed with breast cancer. Maureen and I were fortunate enough to be participants at the very first Hopkins survivor breast cancer retreat. And I went to the retreat really feeling like I was a victim. I'd had cancer, and this, that life was never going to be normal. And I left there feeling like, okay, I'm going to survive.
When the patients come in for biopsy, I get to see them because I introduce myself and I tell them that I'm going to be the support person. And I just start, and everybody wants to talk about themselves, and you find something to talk about. And of course, they're afraid that it's going to be positive. And I said, well, you can do it. You can do this. And I told one lady, I said, you are great. You are just wonderful. And I just think that I had always thought that I would volunteer after retirement, but I never thought that I would be in a hospital setting again. But I am.
There's so much connectedness in our journey. We give meaning to our experience when we get to pass it forward, as you've done, and everybody in this room as volunteers. But our wounds are difficult places, and we can still find strength in them. As one writer, one of my favorite writers, says that our wounds are a place of strength. And I think how strong they make us because they give us our compassion, they give us our backbone. We have this sense of belonging and connectedness, and those are the blessings that come out of this difficult experience. I grieved, but I survived.
So I think, it takes you and it takes your family on a place that you can't control, you can't predict, but there are blessings to be had, and that I would want women to know that you get your life back. That's all I wanted, was to get my life back.
Are there things that you found that were helpful to cope with the grief, cope with the sadness, cope with the residual feelings? Were there things that you did, people that you talked to?
For me, just learning that was normal was a huge weight off my shoulders. There was a lady in our program who was a counselor for cancer, specifically for cancer patients, and I went to talk to her and said, everybody thinks that I should be better, and I don't know why I still feel so sad. And with her reassurance that was normal, that alone made me feel better. And I knew that just some patience and time, it really is true that there's just the tincture of time that you need to heal those wounds. And to remember too all the things that we're grieving. In some cases we're just grieving the luxury of careless living. We've had something unfortunate happen to us, something that was in many cases against the odds if we were very young. And that vulnerability and that experience, it makes you long for the days that you just knew that you would always be all right.
I'm not a crier. I don't know why. I figure I've cried enough for a couple of generations beyond me. And my friends thought that I should cry. I never said, why me? But I think that I start feeling much better about me having cancer just when I started volunteering.
I think another great thing about volunteering is that you really do forget how far you've come. So you're still feeling like you're not quite where you want to be, and then you meet a woman who was diagnosed 10 minutes ago, 10 days ago, and you talk with her and you hear your own words and her words, and you remember then where you were and how it felt. And it makes you realize that you're not there anymore. You might not be where you want to be, but you're not there anymore. And that, I think, can really help you realize where you are on the journey. Because it's sometimes hard to get a perspective of how far you have come.